Coming up today, a car crash changed one man's life in ways he never expected. What doctors discovered during a routine scan after that accident, and how a devastating diagnosis led to life-saving treatment and a remarkable comeback. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Matt Larsen's life came to a screeching halt after a car crash revealed Matt had an aggressive form of kidney cancer. Matt credits his care team at the University of Kansas Cancer Center with helping him get his life back on track. 47-year-old Matt Larsen leads quite a life.
You guys having a great time?
By night, he's the ringmaster of the local wrestling world in Kansas City.
Somebody's going to walk out a legend, and somebody is going to walk out looking for excuses.
By day, he's in the courtroom fighting for his clients. He's been practicing law for the past 15 years and recently opened his own practice.
I'm driving home, and a guy blows a stop sign and hits me, totals my car.
He now credits that guy for saving his life.
Damn near killed me, but he also kind of saved my life too. So I didn't know whether to send him a lawsuit or a thank you card.
Matt jokes about it now, but at that moment he was taken to the hospital where doctors ran tests. What they discovered changed everything.
Doing a CT scan of my abdomen, they found a 10-centimeter mass connected to my right kidney.
Matt was referred to the University of Kansas Cancer Center. He immediately knew he was in the right hands.
When they looked at the scan, they said, well, first of all, we're not going to go in with a machine, we're going to go in by hand, because I need to see in there and see exactly what's going on. Also, we're not only just going to remove the kidney, we're also going to remove your adrenal gland and also your surrounding lymph nodes.
But the news wasn't good. It was cancer.
They said I had stage 4 renal cell carcinoma.
An aggressive form of kidney cancer.
I was so depressed, and hearing that, and you just think it's a death sentence. It's like, how many years do I have left?
After the surgery to remove the kidney and the lymph nodes, his doctors put Matt on an immunotherapy regimen. 17 treatments in a little more than a year.
My expectation was I'm going to feel terrible for the next few years. I'm going to look terrible. I'm going to feel terrible. I'm not going to be able to do my job. But that's not the case at all. You're right. With the advancement, I feel so blessed. KU has done so much advancement with cancer research. If this was 10 years ago, I probably would be on that track.
He's been considered cancer-free for more than 3 years now and remembers the day he got to ring the bell.
They gave me a certificate, and all the nurses from the floor signed it. It was just lovely, and I put it right next to my law degree. It's not really an award, but it was just this thing I'm just so proud of, and it's really not so much I'm proud of myself, but I'm so proud of all those people.
Ladies and gentlemen, the fighters scheduled are sponsored by On The Go Chiropractic.
Matt is back to the hustle of life. He feels somewhat like he's starting over, but in a good way. He even lost 100 pounds.
Yeah, it's almost like the phoenix rising. I mean, law school was hard enough, and then to get stage 4 cancer, like subsequent that, it's like, okay, well, all right. And so I realized that I have a life to live. I just keep on going up, 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 up.
And we're so happy to have Matt Larsen joining us this morning. How are you?
Standing. Just watching that just warms my heart. So thank you.
Well, we are glad you are doing well, and we're so glad to have a couple of members of your care team with us today. Urological oncologist Dr. Eugene Lee is joining us. Good to have you with us.
Good morning. Good to be here.
Yes, and medical oncologist and palliative care specialist Dr. Elizabeth Wolf is with us again. How are you?
Thrilled.
Always great to have you. Always good to have one of your patients doing
it's so
well.
Wonderful. Yes, it's
Dr.
a blessing
Lee,
to be able to do so.
Good to see Matt doing well today,
It's good to see you.
It's great to see you folks.
Yeah.
These are my guardian angels.
Matt, you say that quite a bit. I know you have sung their praises and just credit them for you doing so well these days, right?
Yes, ma'am.
Matt, I want to start with your story, the beginning, because you joked when we spoke that man that kind of kickstarted this whole story, he hit your car, but you kind of say he saved your life in a way, right?
Yeah. Would have thought that the day before trial started, this guy would hit me and wreck my car and just totally change my life for the better. Oddly enough, I got a concussion, and yet I came out of it with stage 4 cancer, and I met this great team of Dr. Lee and Dr. Wolf, and they're just the best people, and they're almost like family right now.
That's what you tell us. So what do you make of this random accident and ending up leading to this life-changing diagnosis?
Well, I think divine intervention, is it serendipitous? I don't know. I don't really know what to make of it, but I'm just glad it happened, and just glad that KU was the driving force behind getting me better. You just can't thank them enough.
Dr. Lee, this mass was discovered during a CT scan after the crash happened. How often do you catch cancers in this way? Someone being scanned for one thing, and then you end up discovering something quite unexpected.
So if you look at the literature, it would suggest about 50 to 60% of patients are diagnosed incidentally, or I like to tell my patients accidentally. I think in my practice, it seems like more though. I mean, with so many ultrasounds and CT scans and MRIs that we do for various reasons, we find tumors on the kidneys quite frequently without any symptoms whatsoever.
Dr. Wolf, Matt was diagnosed with stage 4 renal cell carcinoma. Big picture, what does that mean?
Well, in solid tumors, staging is pretty important in solid tumors, numerical staging, versus in liquid tumors like leukemia, lymphoma, and multiple myeloma. It has a little bit of different utility and connotations and prognostic value. But in kidney cancer, it refers to the idea that the kidney cancer has gotten to another organ or set of tissues other than where it started. And so when at the time of this diagnosis, his involved the adrenal gland, but kind of as a skip lesion essentially. And so that just tells us it had made its way to another organ system. And previously that, would have been a very life-altering, I mean, it's life-altering no matter what, but it would have been permanently life-threatening. And now we have technology that allows us to treat these cancers that are stage 4 kidney cancers that have all been resected and kind of do a cleanup treatment. So it's really changed.
Matt, you said when you first heard stage 4 cancer, your mind went straight to this worst case scenario. Take us through those moments. How did it feel for you?
Well, I'm smiling now because I'm through the worst part of it. But that's a great question. When you hear stage 4, I think the question was, all right, so is there a stage 5? And Dr. Wolf said, no. It's just stage 4. And I think I just broke down and really was trying to just keep myself together, and because you're just in shock at that point. But then you go through all the stages of grief and anger, and there was a lot of anger, but eventually though, KU gave me hope, and that was really what I needed.
Dr. Wolf, how do you have those conversations of hope? A stage 4, like you said, there is no stage 5, but you were able to give Matt hope. What were those conversations like with him?
They're awful conversations for people on the other side of my stethoscope. It's, one of the hardest parts of my job is to show up and break people's hearts every day in a way at first, but of course, the emotion and grieving that comes along with that is perfectly appropriate and normal and healthy. And then my job is to then say, and to reinforce non-abandonment and to tell people what the action plan will be. Here is what, even this is the case, and this is what it can mean. And sometimes saying there are alternatives but it also could mean that we could give you a treatment that could clean up any microscopic cells so that then this wouldn't impact how long you live or how well you live. So I think I do want everyone who works with me to have a really comprehensive sense about their cancer stage and status, and then we move into action. And people usually leave feeling better, despite how painful the conversation can be.
Well, and knowing there's an action plan.
Yes, yeah.
For sure. Dr. Lee, surgeons removed Matt's kidney, his adrenal gland, and his surrounding lymph nodes. Why is surgery often the first step when treating renal cell carcinoma, or is it always the first step?
So for localized kidney cancer, so disease that we think has not metastasized to other places, oftentimes surgery is the first step because it is potentially curable. And in a lot of cases, localized disease is curable. We've gone through a little bit of changes through the years in terms of metastatic stage 4 kidney cancer, in terms of the role that surgery plays in stage 4 disease. In Matt's case, I felt like with surgery, I could not only remove the primary kidney and the kidney cancer, but I could also remove his adrenal gland at the same time. So I felt like that was the most appropriate first step for him because I could get him disease-free with surgery, at least the bulk of the disease, not the potential micrometastatic disease. But yeah, that's why surgery is the first step, because oftentimes it is curable.
So what are those conversations like from a surgical standpoint when you're talking to a stage 4 kidney cancer patient like Matt?
It is challenging because I think that the hardest part for patients and hardest part for people with any anxious thoughts is the fear of the unknown. And when you're talking about advanced kidney cancer, having the discussion of, okay, I'm going to take your kidney out or I'm going to take the tumor out, but what we don't know is, are there cells in other places? And we don't have any testing right now to determine whether there are cells in other places. So having that conversation and telling them we don't know the answer to this is kind of a challenging discussion for most patients.
Matt, after surgery, you went through 17 immunotherapy treatments. What was that experience like for you?
You know, I think it was depressing. I think it was depressing the fact that I was one of the younger people there. But everybody there is just so happy, and they're just there. It seems like they're just so. For them, it's not a job; it's a calling. And all the nurses and all the administrative staff are just so wonderful and loving. And the immunotherapy itself really wasn't that bad. I was surprised. I thought it was going to be like what you see on TV with chemo and radiation therapies But for me, it was just kind of I just sat there and they just did an intravenous, whatever you call it. And I just sat there for an hour and a half, and that was it.
You said you were surprised that you were able to
quite wonderful.
you were able to kind of keep your normal life, so to speak, right?
I could still work. I was still going to trial. I was still moving around, and it was wonderful. I mean, it's weird to say it was the best cancer I ever had.
Well, we love that you're able to joke about it now. I mean, what else are you going to do? Dr. Wolf, Matt received immunotherapy, and again, I think sometimes immunotherapy and chemotherapy somehow get kind of intertwined because you hear them come up in the same conversations. Quite different therapies. Mm-hmm. Explain the differences.
Yes. So chemotherapy is a medication in which it's kind of a curated toxin in a way, in which the medicine itself causes disruptions to DNA, to cell replication by, sometimes chemotherapy molecules get inserted into DNA so that when they try to replicate, they break, and there's just different types of chemotherapy. But it's really, the difference is it's the medicine that's doing something to the cancer. Unfortunately, there's a lot of bystander tissues that are impacted by those curated toxins in a way. And please know, I do prescribe chemotherapy when it's needed. It's just that kidney cancer doesn't really benefit, and we have much more specialized treatments. Now, immunotherapy is different because what immunotherapy does is it tries to take our foot off the brake of the immune system. Cancer is very good at hiding from the immune system and can kind of put the brakes on the car, even though we have cells all floating around in our body all the time that have natural anti-cancer properties. And so because we know about this, these immunotherapy medicines, essentially, they get in the way of the cancer putting that break down. And so what that means is it's your own body's immune system that's doing the work to fight the cancer, to kind of seek out cancer cells and destroy them. And while that is, again, it is a life-saving treatment, and it's proven that it increases the chance of cure for this disease. It is unpredictable because just like our own native immune systems are unpredictable, and some of us have autoimmune conditions like eczema, all the way to rheumatoid arthritis or Crohn's disease. When we're born, most of us, that could not be predicted for us. And so this is sort of similar in that it can induce some autoimmune complications as well. But so it's unpredictable, which is the trade-off, but it is more targeted, and it has been able to treat cancers that otherwise didn't have medicine treatments, really.
Matt, a powerful moment in your story and many people's story when they get through with their cancer journey is ringing the bell after finishing treatment. What did that moment mean to you?
Well, if you don't know, if anytime you're sitting there and you're getting treatment and you hear the bell ringing, that means somebody's finished their final treatment for cancer. And so everybody claps and cheers and hollers and whatever. And so you just don't know what that's going to feel like once you finally get to that point. And so finally, when I'm the one ringing the bell 17 months later, and all the nurses are there and they're clapping, and it's just a wonderful feeling. It's just really, it's hard to talk about because it's so wonderful.
It just hit me. It just hit me though, Matt, because I don't think we think about, a place where people are getting their treatment and that sound of hearing the bell ring for so many other people as you're getting your treatment over the weeks and months and going, when's my turn coming?
Well, and we have changed it to some degree because traditionally there are patients who have more advanced cancers that maybe their treatment doesn't have a beginning, a middle, and an end. And so now we encourage patients to ring it for whatever achievement that they want to. But, to be fair to Matt, of course people gathered around. He engendered such support in the cancer center and was so generous with all of the, everyone he came into contact with at the cancer center. So I know everyone was genuinely happy to show up for him.
Matt, hold up what you were showing us and tell us what that's all about.
Oh yeah, no, this is the certificate I got when I rang the bell, and I do keep it right next to my law degree. And so that wasn't just a promo. I mean, this is legit. This is really one of the proudest moments of my life. And so I owe that to Dr. Lee, Dr. Wolf, and everybody else over at KU. So thank you so much. You guys mean a lot to me. And also my mom was Dr. Lee's second grade teacher.
I know. I mean, this is such a full circle moment. Dr. Lee, do you remember?
I do.
This is Matt.
So after surgery, we meet with families in the consultation room. And so I'm sitting there in the consultation room and I'm having a discussion with Matt's family, and as I'm having the discussion, I said, she looks awfully familiar. And then halfway through, I realized that she was my second grade teacher at Chin Elementary School. And my question to her was so awkward because I said, this is a weird question, but by chance, what did you do for work? And then she told me she was an elementary school teacher. And then, unfortunately, she didn't remember me.
How could she not remember you?
But then I asked her if she remembered my best friend, and she remembered him, but it was because he got in trouble a lot.
Oh, well, there you go. There you go. That is such a
yeah.
But what a cool moment. Matt, just to know that this kind of, again, this full circle moment of everybody kind of knowing each other, and again, like you said, feeling like you're in really, really good hands. And I have to say, the medicine takes you so far. But what's it like just knowing that you have a patient like Matt that just has this really good attitude and taking things in stride, has a little humor, so grateful to those around him. Yeah. What kind of difference does that make?
I think it makes such a huge difference that we did a research study on this. We looked at patients' resilience and grit scores in a patient population because of patients like Matt who are motivated and positive and encouraging and all of those things. having support systems in place. I think that is really, really huge for patients and oftentimes leads to really good outcomes. And so I think it's fantastic to have patients like Matt.
Grit score, is that an actual term? I
So
think it should
grit
be.
and resilience, yeah. There's a body of work and research
love
in
that.
resilience, and
There should
yes,
be.
I think we all could use more resilience and grit in our lives,
Yes.
and we're constantly working on it.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Matt, you had an incredible comeback since treatment, including you lost 100 pounds. Tell us about that experience.
Yeah, now I'm on Mount Jaro, and I'm down actually 125, and I'm actually thinner. I was a little embarrassed because when we cut the B-roll, I was like, oh wow, I was looking kind of chubby there. So, but no, I'm still losing weight, and I'm still doing great. So I just love it. It's just I'm finally out. I'm active. I'm practicing on my own now, and practicing law on my own, and I still see Dr. Lee and Dr. Wolf, and I always enjoy that, just to make sure that everything's on the up and up. But yeah, everything's smooth sailing so far. Can't complain.
So how much did this diagnosis change just the way you look at your health and your life?
I was kind of depressed before. It's odd because I was depressed before before I was diagnosed, and then with the daily grind of work. But then you get that, and then you just get this whole new perspective on life, and so yeah, it did change my life for the better. Cancer changed my life for the better. I don't know if anybody's ever said that, but for me, that's absolutely true.
Well, that goes right along with the attitude and the resiliency that we've been talking about here this morning. Dr. Wolf, Matt talked about how different his experience was, more than he expected when he had immunotherapy. How have advances in immunotherapy changed? How has it changed for the outlook of patients with kidney cancer in the future?
It's had a really big impact. Since 1978, there's essentially been one trial that's been done that has shown that either that a post-operative treatment increases the chance of cure from resected kidney cancer. And again, there were more than 12,000 patients who participated in trials to get to this trial, Keynote 564, that found something that can help augment what my partners who perform, urologic oncology surgeries already are doing. And so it delays the time until recurrence. It decreases the chance of recurrence and decreases the chance of death. And so that is, exactly what we're hoping a medical treatment for a resected cancer will do. We think that treatments like this, work by essentially seeking out and destroying any micrometastatic cells, like a cell that might just be on its own or in a cluster of a few hundred that are too small to see on a scan. But by harnessing the power of the immune system, they can go find them, destroy them, and prevent them from taking root somewhere else and keep the person safe from a recurrence.
Dr. Lee, 10 or 15 years ago, perhaps this might have been a different story in terms of treatment, research. For renal cancer, carcinoma, in terms of outcomes, how would the story have been different?
Absolutely. I would really just applaud my colleagues for the treatments that they do. I think surgical technology has improved over time. I mean, we do more minimally invasive surgery. We do a lot more robotics. I do robotic surgery and open surgery. And as Matt alluded to before, in his case, I felt like an open approach was more safe in his case, and I could be more thorough and meticulous with his disease process. But when it comes to the treatment of stage 4 cancers, though, I think it really is the advances in systemic therapies that Dr. Wolf has mentioned that has really changed the lives of a lot of our patients.
Okay, Matt, you are an attorney by day, as you have mentioned. Tell us about your night job. How did this find you?
I don't know how these things find me, but I have a friend of mine who owns a local wrestling company called CSW Wrestling, and so I just said, hey, I used to do this kind of work before. If you want me to get up there and do it, I will. And sure enough, he was like, yeah, man, go ahead. And so that's what I've been moonlighting as a pro wrestling announcer for the past, I guess, 6 months now.
I think that seems like
And
a
it's
pretty
fun.
good
I
outlet.
love it.
Yeah, get out there.
Yeah, as long as I'm not the one getting hit, yeah, I'm good.
Absolutely, absolutely. I think that looks like that looks like a lot of fun. Yeah, stay out of the way. Dr. Wolf, when patients finish treatment and are considered cancer-free, what does the follow-up care look like? What's the surveillance for Matt moving forward?
Yes. So generally speaking, it's with labs and imaging, and those start on a more frequent schedule in the early few years post-treatment, and then space out after that in accordance with kind of the risk of recurrence being lower. I mean, after every single scan, the risk of recurrence gets lower and lower. And so that's something that actually he's been doing with Dr. Lee, because historically that's been something in which urologists had a lot of expertise. And so while we all pitch in here and all show up for our patients, it's something that Dr. Lee has been owning for Matt. But it depends on the year. But we do surveillance imaging the whole first year, of course, when they're on their treatment as well, and then just continue from there.
Dr. Lee, stories like Matt showed just how important just getting checked out is and staying up with your health is. But as far as, in this case, it was found through an unusual way. But how do you do early detection when it comes to this type of cancer and just kidney health in general?
Yeah, so in kidney cancer, there's really not a role for early detection. There's no screening tools. Oftentimes it's found accidentally, as we've mentioned. I think the takeaway oftentimes for me with patients is to ask questions, find a team that you trust, and going back to your last comment, so Dr. Wolf and I are right across the hall from each other on Monday clinics, and so it is not uncommon for us to pop into each other's clinics to discuss mutual patients, other patients, bounce ideas off of each other, message each other. And I'd say that goes across the board for our entire teams. Our GU team here, very collegial. And so when a patient like Matt walks in the door, it's not just one person discussing his case, it's multiple of us discussing his case, which I think is really important for a team to feel comfortable with.
Get to some questions from our viewers this morning, and we've got one from Jeremy. Why do you have to remove nearby lymph nodes sometimes? At that point, are they compromised in a way that they'll bring the cancer back if you don't take them out?
So in the urologic oncology literature, the evidence for lymph node dissection is really for patients where we are already suspicious that there is disease in the lymph nodes. So in those situations, we do remove the lymph nodes. Oftentimes, if there is no suspicion, we don't remove the lymph nodes. There are additional risks of lymph node dissections. And so we want to mitigate those risks by not doing them if there's no evidence for it, which there isn't at the current time.
And last question, David wants to know, are there certain risk factors that make someone more likely to develop renal cell carcinoma?
There are some. I mean, we do know that smoking is associated. It looks like there may be some trends about people's body weight being associated with the risk. Only about 1% to 2% of kidney cancers overall are inherited. So most of the time they are spontaneous or just bad luck cancers. But smoking is really the one that I think is the biggest and most important risk.
Matt, thank you so much for just being with us today and sharing your story. What do you want the big takeaway from your story to be? What do you want people to know?
I think the main thing is that there's hope, and I believe Dr. Wolf has told me this, is that immunotherapy, they're looking at it as it being even more of a cure now for cancer, which is crazy. And so just hope that everybody kind of stays positive and knows that the science is getting better, and that there are great people at KU Cancer Center that are there to help you and hold your hand and walk you through it.
Well, again, thank you so much, Matt, for sharing, and just be well, okay?
Thank you. You too.
Thank you.
Thank you, doctors.
Dr. Lee, what's the big takeaway?
Yeah, I think just like what Matt said, I think positivity, being an advocate for yourself, asking for, in wanting a care team that you mesh with, I think is important as well too.
Dr. Wolf, wrap us up. What's the big takeaway today?
Well, I do think that, something Dr. Lee mentioned really resonated with me, which is that coming to a comprehensive cancer center, like where we're proud to practice, it is really an interdisciplinary experience with ongoing communication with all members of the care team. And even though Matt, I think in many ways felt like he came to us at his worst. He had been injured and concussed and was really, had a new stage 4 cancer diagnosis. We are here to scoop up anybody in those circumstances, get our arms around them, and help shepherd them to a better, longer life. And I think that he illustrates that so beautifully.
Docs, thanks so much for your insight today. Thank you to all of our guests for being with us. Thanks to our viewers for joining us today. We'll see you back here tomorrow. And tomorrow, coming up, 1 minute he's awake, the next minute he's opening his eyes 8 days later. How a collaborative approach by doctors and nurses at the University of Kansas Health System saved Scott Miller's life.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.